psychologist is not there only when there is a problem.
Is a 15 years old really ready for a surgery?
Aesthetic medicine is a part of the mental well-being.
Don't run after this body perfection.
You have the world full of people who are mentally not so stable.
Everybody needs psychological support.
A clinical psychologist can spot when a person is not well.
Really, her breast was touching her thighs.
Dr. Matteo Vigo is a leading plastic surgeon in Dubai with over 20 years of experience in breast augmentation and cosmetic surgeries.
He is also one of the first UAE licensed surgeons to perform Mia Femtech, a minimally invasive breast enhancement procedure that delivers natural results with minimal scarring in less than 15 minutes.
Dr. Matteo Vigo, where precision, expertise, and care come together to create life-changing transformations with natural, lasting results.
Hello everyone and welcome to another episode of Beauty Talks with Dr. Matteo Vigo. Today I'm very excited because I'm bringing you a topic which is very important in my profession, and it's about the psychology around plastic surgery. Who is more qualified to talk about that than a psychologist? So I invited my good friend and colleague, Dr. Valeria Risoli.
Ciao Matteo, buongiorno a tutti, good morning to everyone.
Thank you so much for being here. She's
Thank
Italian
you.
as me. You know, most of my guests are Italian. We have a very strong Italian community in the medical field in Dubai. I decided to invite you here because we had shared some experience in the past regarding patients, and because I think it's very important to deliver a message regarding plastic surgery, what is good and what is bad about plastic surgery, and what the patient has to look for in my field. So give us a little bit of introduction about yourself, your background.
I am a clinical psychologist. I work with children, offering any kind of assessment, with adults, with couple. I've been in the Middle East for 16, almost 17 years now.
More than me.
And I'm very happy to be in this side of the world. I like to think that as a psychologist, I help people. We are social being. So I help people feel better with their relationship, that they build since they are children. The relationship with our parents, the relationship with our friends, with our colleague, with anyone around us, and very important is the relationship with ourselves. So the well-being depends on the relationship that we build with ourselves, the way we look at ourselves, the way we feel about ourselves, the way we look, and this is connected to what we are going to talk about. So I like to think that a psychologist, a clinical psychologist, can spot when a person is not well, in premise with the relationship with themselves and then with others.
Because then I think if you're not okay with yourself, it reflects
on
the relationship with others.
But it reflects on any decision that we make in life, professionally, relationship-wise, everything. With any intervention also that we seek in terms of aesthetic medicine, everything we choose depends on, in my view, on how we see ourselves, through ourselves and through the relationship that we build.
Absolutely. What is the main misconception that patients have about plastic surgery? And maybe you have seen some of my patients, you've seen some other patients that were not mine that had this kind of problems with plastic surgery, in the sense that they were not ready to face it. They were first forced to face the plastic surgery from somebody else. So what is the biggest misconception the patient have about plastic surgery?
I think that, it depends also on the cultural background, also the society where we live in. It depends all on the mental well-being, in my view. So some patients might be afraid of approaching a plastic surgeon because they are afraid of the drastic change that they are going to face, and that already makes you spot a little bit of anxiety that maybe needs to be addressed. Some patients are more open to any kind of intervention that can help you feel better. So it really depends on the individual. I think that aesthetic surgery, plastic surgery is just a tool like any other things that we do, aim at feeling better about ourselves, about the way we look, about...
You don't see anything bad about plastic surgery,
Well,
right?
in my view, it's not the plastic surgery itself that is bad. It's again is the extreme of anything we do.
And if it's done, and this is the main topic of today, if it's done for the wrong motivation.
Absolutely, but that's why the starting point is always the well-being of the individual. Even if we are extreme in something that is healthy, that could be diet, could be sport, could be anything, a passion. If it is extreme, it suggests that there is some sort of emotional instability or lack of well-being. So that is the motivation, the self-awareness is something that we need to assess, in my view, before we approach plastic surgery, especially those interventions that can be permanent, have a permanent or
Which
long-term.
most of them are
long-term
actually, yes.
effect.
Because we can divide the aesthetic medicine and plastic surgery. Aesthetic medicine is something more temporary. Subtle can be reversed. Plastic surgery, it's a permanent scar for life in all the possible senses. So it's very important the patient is ready. And I feel sometimes stealing a little bit of your job. I feel like a little bit of psychologist. When the patient comes in my office, I immediately look how they sit, how they move, how they talk, if somebody's with them, how they interact with the other person, which is the husband, the wife, the sister, the boyfriend, whoever. And I need to understand the red flags.
Yes, well, I think maybe I'm just, I say this because I'm a psychologist, but I think that psychology should apply and should work align in everything we do, in anything we do. Now, I'm not saying that if a person approach you just because, I don't know, the specific name of all the procedure, but a minor procedure. No, I'm not saying that you have to send to a psychologist, but I think that making sure that in anything we do, important decision, and the way we look, it is something important that can have an impact on us and on people around us. Every time we approach something so important, we have to make sure that our mental well-being is somehow stable and fair.
No, definitely. And that's why when I understand there is something hidden, maybe the patient try to cover it up, but I always prefer to send to you, to one of your colleagues, the patient, to say, okay, give me your feedback. Is this patient ready for surgery? Because then it will reflect back to me, because if the patient not ready, it will be a hell after the procedure, because the patient will have a crash.
You see, this is a situation that can be somehow tricky in the sense that if a person is mentally, I say okay, that doesn't mean anything but means that she's in a good place emotionally, she might not need to consult a psychologist. On the other side, you might find those people that need a consultation before but may refuse to go. I mean, have you
Yes.
had cases where the patient had all the red flags, where there was something going on emotionally, psychologically that was not advised or not well. So you advised to go to a psychologist. Did they go or not?
And most of the time, no, because these people having already psychological issues, they don't accept it. So they don't want to acknowledge that they need you or your colleagues, and they get offended. They said, you are telling me I'm crazy. So there is still this stigma, unfortunately, to go into a psychologist, that if you go to a psychologist, you're crazy. That's not the reality.
We should overcome that
I know, but
stigma.
It's still not. Again, as you said, especially in Dubai, we have a lot of cultural backgrounds, and most of them, they're still back in the years. They're not in the 2025 the way
I would
they
say
think.
everywhere. Even in Italy, everywhere, I would say.
Everywhere. But here, because you see all of the world coming to Dubai, you see in each country, and
Yes,
we have a big pot
yeah.
of this. And they are not ready, and they got offended because they tell you need to see someone about this. I remember I had a patient, I did a breast, had an amazing result, and a few weeks after the procedure, she was always happy, sending Sarah messages that, a lot of hearts, oh my God, I love you guys, I'm so happy with my result. She suddenly, something triggered her, she was not happy anymore. And she started complaining about her result, etc. To the point that she came to me saying that I'm not able to go to work. And she was making a work in a uniform. She's not a bikini model, okay? Because I'm ashamed of my result, which absolutely didn't have anything to be ashamed of. Was absolutely. And digging into these things, I discovered that she had already a psychiatric issue before. I didn't read the red flags when I saw her. She was so nice. I remember also I sent her to my colleague, the breast surgeon that had evaluated because she had a mother with breast cancer, etc. And she said, oh, this patient is so nice, lovely. None of us had the hint that she might have a problem.
Well, in the intake form, if you have an intake form, a registration form, do you ask if there is a history of
Yes.
mental disorder?
But do you think the patient is writing it down? That's the problem. Sometimes they lie about the surgery they've done before. I said, have you done any surgery? Nothing.
But that's why, to make sure that the patient is okay, is emotionally stable, psychologically in a good place, is so important also for us, for the professional himself. Because there could be a repercussion on you.
It's very difficult, as you said, to deliver this message to the patient. Because if the patient is okay, is in a good place, let's say emotionally, and if you tell them, oh, I always do a psychological assessment to the patient, you say, okay, yes, fine, why not? Nice to talk with somebody, and he can start a working relationship with you, because maybe find good psychologists in you and said, okay, we can continue for other things not related to the plastic surgery. But the patient who have already the problem, the issue, and they're not followed already, it's difficult for me.
But what you say is so important. Maybe actually we should really think, the professional in the field should really think to create a sort of a collaboration, especially when you have important surgery. What do you think?
It should be. Honestly, in my career, I'm 20 years in the field, I had very few cases where I misinterpret the patient and then a problem for the psychology of the patient. Most of the time, I spotted the patient is healthy, mentally healthy to go ahead, so okay. I don't need your help. Everybody needs a psychologist, but maybe not in that moment. And in some other cases, when I realized that they're not mentally stable, they have any kind of problem, psychological problem, and they're not willing to accept my suggestion to come to visit you, I just refuse the surgery. I just say, I cannot help you.
And I think that is what define a professional with ethical values and common sense.
Common sense is not good for me, because this patient will only create problems for me, and it's not good for the patient. So my main goal, I always said, my practice is patient-centric. So it's all around the patient. So if the patient is not ready, I'm not ready.
You see, I have patients, you know very well, that I myself send to you for a consultation, because I think that there are certain motivation in the patient that, we can distinguish between healthy motivation and unhealthy motivation. So, for example,
that's very interesting.
But that's why some patients I refer to consult. I refer them to you because let's say that you have a person who has been unhappy about something specific about their body. I don't know, a bump on the nose, or maybe anything that she has been feeling insecure about, that gave her a sense of inadequacy. Maybe she has been bullied, or he has been bullied through life because of this. I think that aesthetic medicine, plastic surgery is such an important part of the therapeutic plan, because if you can just make that person feel happy, to take away that call it defect, or just that feature imperfection that made that person feel so insecure, why not? And I suggest people to consult you and your colleague when I know that the person is fully aware of herself, has common sense, that is not so common in life, we know, but has common sense, has a good self-awareness, has realistic expectations. So I think these are the cases where plastic surgery is part of the psychological treatment plan.
Yeah. I think also one big part of the plastic surgery for healthy reasons is also the facing the aging. People want to age gracefully, and
people don't want to age. Maybe people, I don't want to age, but it's inevitable. So
yeah, but what you might look for is a graceful way to age. So you are in a mental position, you can accept your aging process without making a drama. But I said, if I can do something here and there to make it less evident and make me feel better when I look at myself in the mirror, again, we are
why
aging.
Not?
Exactly, why not? And again, this is a healthy reason.
Common sense is so important, realistic expectations, because I think that it's not only on the patient, but also on you to realize when the request is unrealistic, like I want to look like I'm 25 and I'm 40 plus.
But also and we are going to the social media in a bit, but just a little hint, what I don't like about some colleagues, the marketing they're doing, they're taking the picture of the patient, aging the before, and then showing the after. So they say, oh, the after is real. Yes, but the before was not real. So the before was very aged.
They do that.
There is one colleague I've seen now, he does liposuction on the neck. So he shows the neck after he infiltrated the local anesthesia. So the neck is 3 times the size that it was before. And then he showed immediate after when the neck is super slim. It was not the real before. And you see this before and after, and people on TikTok, on Instagram say, oh my God, this doctor is the best. Yeah, it's good. It does great. The post is good. But, I can do a post. I can take a normal patient who doesn't need liposuction, infiltrate a lot of liquid, make the neck like this, and then show the real before. And it's not fair.
Is that ethical? Is that...
No, definitely not. But in my field
false
also...
promises.
False promises. And... unfortunately, some of my colleagues are only money-driven, business-driven, and there's no ethic around this. And I'm trying to fight this because I'm busy in my practice. I am able to say no to 10 patients a month if I want to say, I don't operate you and send them away because they have unrealistic expectations. They're not the right candidate also for a procedure. They want something that I cannot deliver. Or I don't have the skills. I'm very humble in that to tell the patient, sorry, this is not my field. There is this other doctor, maybe is better than me. Go to him. And some doctors, they take everything. If they know that they've never done this procedure and they try on a patient.
We cannot try.
They do. I see a lot of
but I want
cases.
to believe that people that act in that way, that I would not define as professional, cannot last.
No, they don't last, definitely. There's been a recent case of a doctor who has been removed his license from Dubai, and because he received complaint every week into Dubai Health Authority. So it's very important that, again, you follow the common sense. As a human being, as a professional, ethics is everything. It's the base of my practice,
Yes.
I don't want to, create expectation in the patient. Oh, you will look this way, and I cannot deliver. My motto is always under promise and over deliver.
Yeah, so you can surprise instead of disappoint.
Exactly.
Yeah.
And it's working because at the end of the day, my patients are coming back. I had, for example, for many years, I used this technology to create a 3D image of the breast after the implantation of an implant to augmentation, etc. And you create an expectation on the patient. And most of the time, the patient comes back and says, doctor, you know what? Your result is better than what I've seen in the computer, in the iPad. I stopped using this because it creates an expectation in the patient, and then I over-deliver. So I said, why do I have to create this? And sometimes these discrepancies also can cause problems to the patient because, I was expecting something, even if it's good, it's not what I was expecting, and it can create. So this is also very important to explain to the patient what I'm gonna giving them.
I think that another, thinking about my patient, I work in a clinic where many patients are diagnosed, for example, with breast cancer. And then, surgery can impact your body. And in this plastic surgery, it is therapeutic. It's so important because after accident, after cancer or any kind of medical condition, your body changes and you might feel so disconnected with the image of yourself because your body is different from what you were before. So I think these are motivation
we create a distinction between the reconstructive surgery after trauma, after cancer, after a disfiguration for whatever reason, and the pure aesthetic one.
Yes.
Where you don't have any problem, you can live your way like that, but you want to
But
change.
especially if a patient is still young, you want to still look how you looked before you were ill. So I think it's so important also to remember how aesthetic medicine is a part of the mental well-being, not only physical well-being.
No, definitely. It's a combination of the two things, because I think we will discuss at the beginning, the self-confidence starts from the outside and then reflects in the inside. So I see, people who are not attractive is a subjective thing. For me, they're not attractive. I'm not saying they're ugly, but they're not attractive, full of confidence.
Absolutely.
And beautiful people with zero confidence.
Yes.
So these two things needs to balance. And again, the mental and the aesthetic part goes hand in hand.
But that's why the way you look at yourself before you do anything is so important. I agree with you. I see people who are objectively, let's say, not the standard of beauty, even if it's subjective, but they are absolutely confident and so very charming, very attractive. It's the charisma, the energy.
And it's also nice, funny sometimes when the patient comes into my practice and already when they walk in the door, I already scan them because in my mind I try to think what they are for. And
do you guess right usually?
But I have some hints because my assistant writes me the notes.
Yeah,
the
but
patient
let's imagine that if she doesn't write anything. Would you?
No, if, for example, they come and say, I want to do Botox and fillers. So it's not a specific thing. And they come and you see, I'll just make an example, big nasolabial fold, okay? And that's the only thing that you as a plastic surgeon will do in her face. They said, I want to do my lips, and they're really big. So the perception that they have of what is wrong in their face is not what is the reality. So my job is also to guide them to say, I'm not going to do your lip bigger because this will not enhance your face, will make you even ugly, will look fatter, will, whatever happens. But it's surprising sometimes when the patient has a big defect, they come with a huge nose and I said, but I want to do my lips. I said, but look at, that's the nose,
proportion,
the proportion. So your lips look smaller because your nose is big. So let's rebalance this thing. You don't have to enhance, to balance. And it's very difficult to give this message to the patient. What I find is extremely difficult to walk on eggs without offending them. Because some patients get, really? You're telling me that I need to
my nose is not good
my
enough?
nose is, and I said, no, you're here because you want a professional also opinion. If I come to you, it's because maybe I know the answers to my problem. But I said, okay, Valeria, I have this problem. What is your vision on this problem? How can you help me, dig into that and solve the root of the cause of this problem? Because you have studied for that, you have experience in that. So in 3 sentences, you understand already the kind of person you have in front, and you can guide them.
But that's why it's so important for you also to spot the red flags of certain mental condition that I'm sure you are already aware because it's part of also your study and being prepared for the patient. But spotting the red flags of certain mental disorder, like if a person come already with a big breast and ask you to have it bigger or big lips or anything that is already a little bit not proportion and almost like aesthetically doesn't look good in an objective way, I think it's good for you to either to refer or to stop the patient, pause the patient, because we have patients with body dysmorphia disorder. I'm sure you are aware of with the obsessive compulsive disorder, always unhappy, happy, obsessing about something. So no matter how many procedure you will do, that patient will not be happy. So that is the risk. And sometimes, they see, because it's a sort of displacement of their anxiety, so they see obsessively imperfection, and you might not notice, the rest of the world might not notice. So it is a disorder that should be spotted and need medical, need psychological intervention. Other disorder is severe anxiety disorder or depression, so unhappiness with the way you look. And it's very difficult to help patients when they are in that state of mind, because no matter what you do, if they don't first work on looking at themselves in a more objective, realistic, and positive or just optimistic way, is very difficult to please, because you have to already compensate for such a depth in terms of mood and negative thinking.
And also I think, and this is a topic that I want to discuss with you, is we are in the era of social media. And if you have social media, what you see is only perfect body, perfect faces, maybe with filters, but not only, Before, you knew that there was the girl with a perfect body, the guy with the six packs. But you see one or two of them sometimes on the beach in the summer. Now it's every day in front of you, and you feel bad about yourself if you don't have the six packs, if you don't have the nice waist or the nice bump in your body. And how much you see this coming into your practice?
Many, especially young people. Not only, but especially young people, because they are spending more time on social media. Talking about body dysmorphia disorder, there is a new pseudo-diagnosis definition of Snapchat dysmorphia, because every image is so potentially filtered, AI. So what you see might not be real. The problem is that they are famous, they have followers, so you idealize those people that you see, and you want to look like them, especially young people. So I have a teenager who want a very small waist or want to change already young, like 14, 15. They want bigger lips. They want cheekbone. They want to change because they want to, and they say, I want to look like that person.
That's the worst thing. When I hear that, my ears bleed, honestly.
And it's the problem is they all look the same. And you lost connection with the idea of yourself. Your identity, the way you look, is completely distorted and confused by an image that you idealize that might not even be realistic and achievable.
And there's idea of perfection. So again, you see the social media, the perfection, the symmetry, and everything like that. And I always report this example to the patient. They did a study with Angelina Jolie and Brad Pitt, the most two handsome people in the world we all know. They took their faces, the photo, they cut in half, and they put one part of the face on the opposite side, make them symmetric. They were not as attractive as they are with their asymmetries. If you look at them, they have asymmetries in the face, and they're much more attractive. So perfection is not always attractiveness. And again, we said before, even a not standard handsome person can be super attractive, can be charming, can be more self-confident and give this this feeling to the rest of the world. So don't run after this body perfection. Everybody's happy to have a perfect face, a perfect skin, and a nice body, whatever. But at the end of the day, is that really the ultimate goal? No.
Well, perfection itself is a neurotic aspect of our, of our thinking.
Utopic also, maybe.
Because the perfection is, what is absolute perfection? So it's never, so perfection itself is like
but also perfection for you is different from perfection for me in any case.
That cannot be achieved. And if you are a perfectionist, the standard potentially constantly change. So you think you reach that standard and then it change again. The problem is with these social media, the target are minors.
And that is...
what do you do when you have... I have patients that young want breast augmentation, or they want to change
The problem is that
something in the
also
face.
sometimes
What do you
have
do?
mothers or parents that bring in the below age patients to do some surgical procedure. And I want to clarify, there is only one, apart from the reconstructive part, you have a trauma, you have an accident, and you can do it at
that
any
is
age.
different.
Imagine that the baby is born with a cleft
Yeah.
palate. Of course, you do a
Or a
plastic
teenager
surgery.
having an accident, I would suggest myself to.
Exactly. The only surgery, aesthetic surgery, that is allowed and worldwide recognized to be performed on a child below 18 is the otoplasty. Because the cartilage after 8 years old is fixed, it will not grow, it will not change. And the cartilage is like a bone. When it's formed, it will not change. So, and at the age of 9, 10, school started bullying. So to prevent this,
absolutely.
and it's been proven by, every, boards of plastic surgery that this is something that we can do, and we do in children after 8 years old. But I have mothers that are bringing the daughter for 15 years. Oh, she wants a breast. And it's the message I give is 2 reasons. One is physical, because her body is not yet completely developed. Okay, even if she's very tall and she has maybe hair, the hormones, but maybe the breast will grow at a later stage. So I need to wait until she's completely developed. And second, is a 15 years old really ready for a surgery?
In my view, no.
Exactly.
Well, 15 years old today might sound more confident, more sure of what they want. The problem is they might change idea later on when they are already 18. So that's the risk. So my suggestion, then you have your idea, but is
No, but I
to
always
say no.
tell, we wait the 18 and, when it's 18. Now, for example, I'm doing this new procedure, it's called MIA, which is a minimal invasive. So the young girls come to me and say, oh, but it's so easy, I can do it, in one go, what's the problem? Yes, the procedure is easy, but the change that you will have in your body is not as easy for you to understand, Sometimes we have, as adults, difficulties to accept this. Imagine a 15-year-old and not completely mentally developed. So the plastic surgery in kids, like below the 18 years old, is something that should be really demonized and, forget about it.
You said the only procedure is the
otoplasty.
Yes, and I think that it's necessary because the consequences and effect of bullying, so many kids are bullied for this. So, but even when they are adult, they remember those moments when they are bullied. So that is something that absolutely should be done.
Yeah, I think I've done a couple in my career, one time when I was back in Italy, there was this 14 years old girl, and her breast grew in an abnormal way. So really her breast was touching her thighs at 14. This is another condition that is reconstructive.
Yes.
Because the bullying, because she could not do sport.
Also for your back, I think, is
exactly.
the weight.
There's a lot of things. So we do this kind of thing, but you evaluate single case. But the breast augmentation, in any case, is a therapeutic procedure, okay? A lip filler is never a therapeutic procedure.
And when you have cases like this, who is more disappointed, the parent or the daughter, the teenager?
The daughter is disappointed, but the parents, they call you back when the daughter is not. Are you really sure you cannot do it? Because, my daughter is really suffering for that.
So in cases like this, you should send the whole...
the parents.
It's true. But it sounds like a joke, but it's true.
But I see a lot of, and I don't enter in this big pool of, parent and kids interaction. But I see a lot of, problems in this sense. The parents, they are, first of all, forgiving anything to the kids. Again, it's not my topic. I'm a plastic surgeon.
No. But yes, I partly agree. And I'm a parent myself, so I'm not going to, when I talk about parenting, I don't think necessarily as a parent, because we all make mistakes with a good intention. So there is no manual of good parenting that can teach you you learn day by day. Absolutely. We need to be humble and realistic. But what I'm saying in cases like this is parents today are afraid of disappointing kids, and they want to make sure that they are always happy. That is the problem. But so there is a lot to talk about that, and maybe this is not the moment, but that is probably the motivation behind a parent like this. It's not negligence or I give her everything. Is the fear that your child might be sad, so preventing your kids to be from being sad, and instant gratification, fear of disappointing what they ask. That is,
and I think I don't know if you told me this or I heard from some other psychologists. The kids need to experience sadness. You cannot
this
prevent
is something that I say. Or I don't know if I say or
maybe you said to me, and it's true. You know, there's not always a happy moment in your life.
No. We need to learn to overcome sadness.
Exactly.
To face it and cope
overcome.
with it.
Yeah, definitely,
that doesn't mean that we want our kids to be sad. We can, if we can prevent that.
Of course.
We have to expose them to an experience and make sure they are resilient to cope. And
another important relationship that I see in my patient is not mother and son, but is husband and wife. And we had some, patients we share, maybe some, experience that you can share with us.
I had this couple that came to me for couple counseling. There was a lot of conflict. There was a lack of affection. Basically, the husband was asking the wife to go through multiple plastic surgeries and procedure to look like an ideal woman that he wanted to have next to him. I mean,
like a doll, you buy a Barbie and then you have it.
But extreme surgery, like breast, many face, different face surgery. So they came to me, and there was a lot of argument about this. And the husband said, "Well, we argue a lot about this. Let's talk about communication. Let's talk about the relationship itself between the two of you." Well, when I had the picture of what was going on, what I suggested was individual counseling to each of them, in parallel also couple counseling. And because I wanted to make sure that there was not some sort of psychological manipulation and came out that she didn't want all this procedure for herself, but she didn't want to disappoint her husband. And I don't know if, you saw her, and I don't think that this is a healthy motivation if you do something to please the expectations of someone else.
Definitely. The moment I see, this is a big red flag.
I mean, that is a huge red flag.
For example, I notice immediately when they come into the office because the husband is talking. Oh, we want to... So, excuse me, I'm not doing a surgery on you, I'm doing a surgery on her.
That's good.
So what you want, and I talk to her. And they're shy, etc. This is a big red flag to me. And I always say, no, this is not going to happen unless we clarify a few things. On the opposite side, we have now a lot of women which are much more empowered now. Very energetic, very self-confident, and they want to do surgery, which is, and then they have a husband on the side that is scared to tell anything if they want to go with big implants, scared to say, no, maybe this is too big, because these women are very powerful. So this is the opposite side of the... Well,
I think that each of us... in theory, in a healthy, mentally speaking, state, should choose for themselves. But in cases like that, maybe, if someone loves you and is close to you, maybe it's just giving you a suggestion, advice.
Exactly. They don't accept this. And even if it comes from me, and then the husband is confirming this point that it's too big, the implant you're choosing, they don't listen. Or too small, even sometimes. They said, in your situation, you need to go a little bit bigger because maybe you're very tall. And this will not... And to me, having a supporting partner is very good. So if I try always to connect with the partner. If they come in a couple... I always try to connect with the husband or the wife if it's the man doing a surgery, because we're only talking women doing surgery, but there's a lot of men doing plastic surgery as well. It's true. I try to connect with the partner because I can have an ally also to support the patient at the end. The patient is the one going under the knife, having the anesthesia, having the recovery period, and if you don't have a support system around, which is another big topic we can open in another maybe podcast, how important it is to surround yourself with the people that can support you it's a journey. And if you are doing it alone, it's very difficult.
And I think that if they come as a couple or with a friend or with a partner, it's so important also for you. You get more information about the state of mind of the patient, of the support system that person has, because I think all of these things has an impact on the result, not the result itself medically, but psychologically.
Yeah.
Because, this is a question actually that I want to ask to you. Do you have patients that maybe are positive about the procedure but extremely anxious? So can you, in cases like this, what do you do? When, you can distinguish when there is apprehension or...
Yeah, I have a lot of patients who are very scared about the anesthesia, for example. This big myth about anesthesia, oh my God, anesthesia, especially if they are, parents. I'm not going to die, I leave my kids alone, which is a normal fears if you want, but nowadays anesthesia, if you do in a proper facility with a proper anesthesiologist, etc., is super safe. I see a lot of patients that they have this pre-surgery anxiety, which is justified. Maybe it's the first, the first procedure they do in their life, the first time they enter in a hospital, the first time they being under the knife, and they're very scared about that. So this is something I can understand. And I'm quite good in spotting it as a normal reaction that doesn't need a psychological support. But if the anxiety comes from different topics and it's just, there's another extra addition to their normal anxiety, I stopped them. I said,
that's what I want to ask. Do you stop?
I say a lot of no to patients. And
it's good for you, because the risk is that patient will come back to you either complaining or unhappy, because sometimes the anxiety is part of the mindset of that person. So
it's definitely important, again, for me to understand this thing and really spot if there is any red flag and divert the patient to you or your colleagues, or say the patient no if they don't accept. What is difficult is deliver the message to the patient that they need support.
Also, I think from your perspective, if a patient is so scared, apart from feeling anxious, I think that also suggests that maybe there is not that trust in the procedure, in you, in the team, in the clinic, that should be there before you go through something like this.
Exactly. No, it's absolutely important. But I think also this maybe you experience yourself, because the patient comes to you usually spontaneously. They understand that they might need.
And if they are sent by someone, it doesn't work.
Exactly. But you might have a lot of husbands sent by the wives or vice versa. Okay. How do you approach these people? Because they're sitting in front of you, they're asking for your help, but in the end, they don't want your help.
In cases when, yes, I have husbands, most husbands, not so much wives sent by the husband, but the husband sent by the wife. Okay, my wife wants me to be here because she thinks I need to be more emotional or more connected or more affectionate. But if the patient doesn't have an inner motivation to be there, to open up, to talk about himself, it doesn't work. Anything we do, as the motivation of anything we do should in theory start from us, in my view.
But we come back and then I think we close almost the session because we already touched all the topics to the initial discussion about the myth of going to the psychologist because you are crazy. How do you say to a patient that everybody needs a psychological support? Like if I want to build my muscle, I go to a personal trainer and I do this.
Exactly.
If I want to learn a skill, I go to the person that is the master in that skill and I learn from that. If I want to master my mental health, I go to someone who can help me with that. How do you address this to the people?
I mean, in this field related to the topic that we are discussing, I think that your role is very important also because they come to you. they trust you, so that you could spot red flags and make them understand how important it is to make sure they are okay, they are happy, they trust you, they are not that anxious because they go through the procedure. So it's something that you could suggest. But on the other side, I mean, you have the world full of people who are mentally not so stable, mentally not so healthy, that are undiagnosed, not diagnosed. I mean, this is the reality. What we can do is, when I have a patient who wants to consult maybe a plastic surgeon, and I feel that the motivations are healthy, she has realistic expectations, she's well connected with herself, has a realistic and positive self-image, then I'm the first one to send to you. But I think that the collaboration between the two of us,
that is also important,
the two professions, is so important.
Because we do in a certain way, but I think a lot of my colleagues they don't. They underestimate the power of this kind of.
Well, why do you think they underestimate? Just because you sign one of these forms that
they maybe the thing they can manage it. You know what they say about? There was a joke about what's the difference between God and a plastic surgeon. Then God doesn't say he's a plastic surgeon because we have a big ego, and it's true, we have a big ego. And sometimes we think that we can do everything by ourselves, even the psychological part, which I'm not trained for. And of course, I don't have your experience and knowledge to. We
have a big ego to add on. We all have big ego. But yes, we cannot manage everything. I think also it's very personal, subjective. I have the ability to say I cannot do this.
Yeah, me too. I'm very also humble. The being humble and saying, I'm sorry, this is out of my scope. For example, I don't do noses. If a patient comes, I trust you, I want to do my nose. No, I cannot do that. I really don't know how to do it. I know the theory. I've never done a nose in my life. How can I give you a good result? For sure it would be a disaster. So no, I'm not doing it. Even some procedures, but it goes a little bit beyond my expertise and my knowledge, I say no. The problem in my field is also, from the plastic surgeon, is also different because they're not that busy, they want to have more patients, so they try to maybe to grab some patients, even if they're not exactly their profession, etc., which is of course not correct and not ethical. But from my point of view, I really stick to what I'm good at, and if I cannot do something, I said I'm sorry, and I said I'm not the right person for you.
Do you think that the stigma of going to a psychologist is a bad thing still so strong?
I was discussing recently with a friend of mine, that she was saying to me that she started many years ago to go to a psychologist, and at that time she didn't have any problem to tell to her friends. She went to her friends and said, I'm going to a psychologist, and everybody came, I'm doing. Nobody was talking about that. That was like 15 years ago.
Yeah.
Nowadays, I think is more accepted. Okay, everybody in the course of their life, they had the need to go. I've been to a psychologist, so it's not something that I'm hiding from.
We have to have been.
We have to.
We all have to.
Exactly. But even sometimes to give a different vision of what is the problem, what is the real, focus. So there is a little bit the stigma. It's when it comes from yourself, so you decide to go, it's much easier. When somebody else suggests another doctor refer you to a psychologist, it's difficult to digest for some patients still. So if I tell my patients, you need to see a psychologist, they got offended.
Perhaps we could frame it in a different way. Going to a psychologist, and I believe in this, is not because you have a problem, you have a mental problem, you are unwell. Because I believe that a psychologist is not there only when there is a problem. A psychologist is there when in life we have to face situation, decision, and we feel we don't have within ourselves, maybe we have, but we feel we don't have the resources to face that decision, that situation. And so a psychologist can help you just see that you discover and see that you actually have those resources mentally, emotionally. And so in your cases, let's put things in this perspective. Not for all minor procedure, I think you have to send to a psychologist. I mean, like in life, if I want to buy something, I don't consult the psychologist. What do you think? But for those situations, those procedures that might be lifelong, permanent change, I think that consulting a psychologist is something that is there, available for you, is a plus to make sure that you are fully aware of your decision. From a medical point of view, you are aware of what the outcome would be, so realistic expectations. And from an emotional point of view, you will be aware that a nose that changes your face doesn't change your life per se, but it changes the way you feel about yourself in a positive way if you are aware. In potentially in a negative way if your expectations were different, but we are talking about positive situations. So when anything we do to with a permanent effect to improve our life, consulting a psychologist is advised simply because you will not regret anything and you will be more aware and more empowered of the decision that you make.
Message.
This is my view.
That is, I think, the closing message that we discussed before we started the podcast. That plastic surgery is not a bad thing, okay, per se, and going to psychology is not a bad thing.
I never harm anyone, so
it's both of them can really help you in finding your self-confidence, in being the best version of yourself, aesthetically and interiorly. And this really can combine and give you a better situation, a better self-confidence and
absolutely,
self-esteem.
and I agree. Just to make sure that is clear, the message. My idea is not to force people to see a psychologist because it's a personal decision, but it's something that we should just frame in a more positive and not so clinical and negative and way. I mean,
but I think the society is going towards, like, for example, came now a very stupid example. 50 years ago, no woman were coloring their hair. Now you don't see, if you see gray hair, it's because they want to make the style now. But a woman with in their 50, 60, they all have gray hair, but they're all, colored, dyed. And that is important,
Absolutely.
that is accepted now. You will never say, even in men now, if they dye their hair, it's not something, oh my God, this man, what is doing? And I think these changes in society are also going towards the mental health. There is a lot of also mental health days, organizations, conferences, because we want to push people into this well-being.
Absolutely.
Everything is about well-being.
And I believe that also this chat that we have can help people to realize that they can approach us in a very, easy way. We are not on a pedestal teaching anything. We are people there helping others understand themselves. That's it.
Yeah, definitely. Okay, so I think we covered all the topics. Thank you so much for being here.
Thank you, Dr. Vigo.
And is a pleasure. We work together. So for sure, if you can find her online, Dr. Valeria Risoli. Risoli. Sorry, why? I missed it up.
I joke about that because I don't mind, but everyone called me Risoli.
Risoli, okay. Valeria Risoli. I know it's in many years and I always call her Risoli.
Always Risoli.
So you can find her online. For my podcast, if you like the episode, please click the subscribe button, like this video, and follow me for more and more guests that are coming on the way. Thank you so much for being here with me today, and thank you, Valeria.
Thank you, everyone.
See you soon. Because you deserve the best.